As students head back to school, a new poll showing strong public support for mental health education and staff training. Numbers from the American Psychiatric Association shows 85% of Americans believe schools should be equipped to connect students with mental health professionals, but only 48% believe most school staff have been trained to identify mental health concerns in students. Here to talk more about it with us is the Rawle Andrews Jr., the Executive Director of the American Psychiatric Association Foundation. Welcome to the show.
Thank you so much. Good morning to you and your audience.
All right, thanks so much. What is your reaction to those poll numbers I just read?
So surprisingly, we're not surprised by the numbers, but there's still time to help get our whole academic community mentally fit and ready to learn as the new school season approaches.
The poll also is confident that schools in their handling of mental health is declining. What do you think about that?
Well, we understand that we really haven't had a break since COVID, and our children have really tried to understand what's going on, and there are just so many things happening. And what we haven't seen at the APA Foundation is that schools are making the right investments to make sure the entire faculty and staff are equipped to deal with the new breed of students coming to the schoolhouse door.
Is that really possible? I mean, when you think about, and maybe part of the issue is the internet, when students have more access to find out about things in the world, of course, that could play along with their mental health. Is it a fight that we can win?
It is a fight we can win, and one of the things the APA Foundation has done is we've developed what we call the Notice, Talk, Act framework, and we've specifically designed it for schools and workplaces. And what Notice Talk Act is designed to do, this is a resource that comes to schools thanks to public and private support at no cost to the school, no cost to the faculty and staff, and no cost to the parents.
Yeah.
And so how do we notice signs and symptoms of distress in our young scholars? How do we turn difficult conversations into courageous conversations because our faculty and staff are better equipped to talk about these mental health concerns? And then finally, when it comes to action, again, this is a free resource. How do we know what the tools, tips, and resources are that can bring help when help is needed?
Quickly walk me through the training for school staff. What does that look like?
So again, it is a virtual or an in-person option. It takes less than 2 hours to go through the training, so it doesn't take all day. But what we love about Notice Talk Act and the way it's designed, we have our physician psychiatrists who have blessed the way this training works. And so it's not going to make you a doctor to take Notice Talk Act. We think of it as the stop, drop, and roll of mental health. You're not becoming a first responder because you took mental health, but what you're going to notice are signs of easy agitation. You might notice signs of extreme apathy, or something that might look like in a young student, a loss of appetite for somebody who used to love, believe it or not, lunch or recess. And so when you see these things, you don't know what you're seeing, but Notice Talk Act is a way, again, a no-cost way to bring that resource to every school in the United States and territories.
What can parents do if they feel like their school lacks the resources?
So the one thing we want anybody to know is that you have the right to have this resource. These are your tax dollars at work. Go to apaf.org/schools, and you can find out more about the training. And what's unique about our way of doing business, if parents reach out to us through apaf.org and say, I want to have this resource brought to my child's school, we'll do the work for you. We just need to know we have the invitation to do so.
All right. Rawle Andrews Jr., appreciate you joining us and appreciate the insight.
Thank you so much. God bless.